Goeienaand, good evening, fellow South Africans and citizens of the world. And I want you to be part of my morning routine now. Vitamin C. Gotta take a crunchable tablet. I have one every morning, building up my immune system against the coronavirus. And that's what we're talking about here. Vitamin D3. Same routine. I hope you guys have got your vitamin C's and vitamin D3. There's a little pill. Goes in my mouth. And down the chute. It's that simple. Simples! Now, there's a very, very serious and underreported development in South Africa with the coronavirus. All the coronavirus confirmed cases up until now, and these are the people who've actually gone and been tested, have been basically people who've come from another part of the world. They've been traveling, and they've probably got it, let's say, in Italy or in the US or wherever. They got it somewhere else, and they came it back into South Africa, and then they got identified as having the coronavirus. That's fine, because you can control someone in isolation if they have the coronavirus. Now, we've talked about clusters, and there's clearly a cluster happening in KwaZulu-Natal now, where the first coronavirus case was found. And what I'm talking about here is the first case of person-to-person infection from within South Africa. This is where the whole pendulum swings badly out of control. Because what this means is that the person who's now been diagnosed as having the coronavirus has somewhere in the street touched something, or someone's breathed on him, and he's caught the coronavirus from an unknown person who resides in that area. i.e., that unknown person has probably infected a whole lot of other people too. This is called a cluster. It's no longer something that's come from overseas, it's something that's been transmitted locally. Huge difference between the two. So in KwaZulu-Natal, you can expect in areas you're going to start finding clusters of infections happening, because someone's out there who hasn't gone in for a test and he's got the coronavirus. Now, I would suggest the same thing is happening in Cape Town. They just haven't identified it yet. Same thing in Gauteng. This is what's happened all over the world. Places like Italy, Iran, Seattle in America. These are three classic examples of clusters with its local infection between two people. Now, let me just tell you what the latest news on the coronavirus is. Health Minister Zweli Mkhize has announced 4 more cases of COVID-19 or coronavirus in South Africa today, with the identification of the first case of local transmission. This brings the total number of positive cases to 17. Now, I believe one of those cases has since been found to be negative, so it's down to 16. So there's like a little breath of air, because we only had 3 cases apparently identified today. The cases were identified in KwaZulu-Natal, Gauteng, Mpumalanga and the Free State, where the first local transmission was recorded. That's what we're talking about. That's the cluster. A 32-year-old male came into contact with a Chinese businessman. This is the first case of local transmission, as all others have been by patients who have travelled abroad, Mkhize said. Let me just play you a little videotape.
And we confirmed the existence of a patient who has tested positive for the COVID-19 virus for the first time in the country. And this patient was identified in the province of KwaZulu-Natal.
Okay, there you heard him say it. He didn't say it really well, but what he was actually meaning is that that person with the coronavirus got it here in South Africa. He added, this is Mkhize, at this stage all patients are in self-quarantine and have mild to moderate symptoms. They are also on symptomatic treatment. So the development here, which is huge, it's really, really huge, and that is that you've now got a local transmission of the virus. All right, guys, please remember to subscribe to be kept informed. Ring the bell for the updates. Please like this video. Please share this video. And above all, please stay safe.